Hi, I'm Dr. Trishala Singh, Senior Physical Therapist at Care Hospitals, Banjara Hills. I'm here to put up a word on physiotherapy during pregnancy. Now, physical activity as such in itself is a great thing for our overall health. But when done in a correct way, it can do wonders. Especially during pregnancy, it will help you have a smoother and an easier pregnancy. There is a lot of misconception that physical activity during pregnancy might cause some fetal issues, meaning low birth weight or preterm labor, but it is not as such. In fact, physiotherapy during pregnancy can be termed as teachable moments of a woman's health, wherein you can have a great time for some lifestyle modification. Now, during your gynecologist visit, your gynecologist might recommend you for some antenatal classes. These antenatal classes will help you to have a better and a smoother pregnancy, a better outcome for your labor, meaning you might have a little less painful labor and a great postpartum recovery. During these antenatal classes, your physiotherapist will assess you in a proper way. They see your fetal scans, position of your baby and everything, fetal heart rate, considering everything. Then he or she shall make a custom made program for you for your antenatal classes. Now, when it comes to antenatal classes, there are a lot of things that can be done. But there are some things you might have to remember before you start on something. Make sure you start slow, you do not overdo, you do not strain yourself. Make exercise as a habit for your day-to-day life. Don't hold on to your breath while you're doing some exercise. Make sure you breathe in normally so that you do not cause any fetal distress. Make sure you are wearing proper clothing, proper footwear so that you don't go off and on balance. You have to have a protocol wherein you are not exerting yourself, you are not doing any, you have to make sure you are avoiding fall risk basically. Do not exert yourself, do not have a exercise wherein you can fall. Do not do double knee bends, do not do double leg raises. Make sure you are not lying supine, meaning lying onto your back for more than 3 minutes after your third trimester, because that might cause some fetal discomfort and decrease cardiac output. But most importantly, you have to remember that how are you supposed to sit, how are you supposed to sleep, how are you supposed to walk and do your course so that you do not have the most common symptom of pregnancy, that is a low back ache. So what benefits does physiotherapy have during pregnancy? It might lower your chances for C-section, it might prevent gestational diabetes, gestational weight gain, urinary incontinence and the most common symptom low back ache. Your baby might not have a low birth weight maybe, and then your outcomes for labor would be better when it comes to physiotherapy during pregnancy. Thank you.